Good morning. Hello, everyone. Thank you for joining us today. Today's Cancer Care virtual seminar topic is colorectal health insurance 101. Sorry about that. Good morning, and our topic for today is health insurance 101. My name is Carmen Boone, and I'm an outreach coordinator for the Samaritan Cancer Resource Center, and I will be your host and moderator. Next. The Cancer Resource Center is the organization bringing this event back to you. We partner with anyone touched by cancer to provide the support they need to live with strength, determination, and hope into the future. Joining us today is Giri. She's a Samaritan Health Service patient financial advocate. And Candy, thank you so much for being here with us today. I will go ahead and pass the presentation over to you.
Hi, everyone. First of all, I want to thank you for joining my first ever webinar. So forgive me if I do seem a little nervous, because I am, but I'm very excited to be here with you today. I want to give you a little bit, tell you a little bit about my background. I've only been here for 4 months in this position as patient financial advocate for the Samaritan Cancer Center. And so I'm still learning. And but it's my hope that if we have a question that I can't answer, I will certainly find out. I don't want to leave any questions unanswered. Before I came here, I was at Samaritan Health Plans for a year, where I spent my time answering questions from healthcare members and providers relating to eligibility, benefits, coverage, claims, authorization, and stuff like that. So this job is very personal for me. I understand how cancer patients feel when they get that C diagnosis, that nasty C word. I am a 2-year cancer survivor. I had ovarian cancer, and I'm very happy to be here. So it's really important, this job. When I first got my diagnosis, I had no understanding about my insurance. I spent endless phone calls with insurance companies, my insurance company, trying to figure out what they're talking about. What is this bill for? Why is this so high? I had no idea. They would use these words that I just had no understanding of. So for me, it was a learning curve. And part of the reason I feel this job is important is because when you get that diagnosis, you're overwhelmed. I can't imagine anyone not being overwhelmed by that. But then to have to worry about the financial piece. So I'm here to try and take some of that stress off of your shoulders, to help you find financing if your insurance is not covering things. So let's get started. Okay, so what we'll be covering today? So common insurance terms. What do you need to know about your insurance? What is the difference between an HMO and a PPO? You probably hear that a lot. And what are the actual parts of Medicare? Medicare is very confusing. It's just not a one-size-fits-all. There are different parts. Then we're going to move on to some examples of kind of insurance math problems. How are certain costs calculated, and your cost, and what does the insurance pay? So things like that. EOB, what is an explanation of benefits, and is it really a bill? What do you do if you don't have health insurance? There are a couple options out there for you. And then next, financial assistance. So I mentioned, what if you can't pay the copays that your insurance is asking? What if everything is becoming too much? So there are some resources out there. And then lastly, we're going to do a Q&A. So, all right. So important things to know about your insurance after a cancer diagnosis, or it doesn't even have to be after a diagnosis. Everyone should know certain things about their insurance. One of the important things is, what is your out-of-pocket max? And if you're going to be covered for certain treatments, especially those treatments which are not usual. I would say genetic testing is one of those. And again, what should I do if I'm not covered for certain treatments? And then, is there someone out there who can help me understand my insurance and help me apply for financial assistance? You're listening to her, so I am here to be your partner through this, and no questions are dumb questions. So please feel free to reach out to me anytime. Okay. Okay, common insurance terms. Okay, deductible. Okay, that is how much you pay in total for certain services before your insurance starts to really kick in. Okay, and that can vary for insurances. My insurance right now is $450. I've had insurances where that's $5,000. So obviously, if your deductible is low, that's a wonderful thing. Next is copay, and that is a fixed amount you pay for certain services, like a doctor's visit. Maybe you have a $20 copay, or x-rays, maybe you have a $150 copay. And the difference between that and co-insurance is a percentage. So let's say you have a surgery, and your surgery may be a 20% co-insurance. So that means you will have to pay 20% of that surgery cost. Okay. All right, go ahead. And are there any questions so far? I don't know if I'm seeing the right.
No questions yet. And
okay, got it. Okay, perfect. Out-of-pocket max. This is one of the things I would say. This and your deductible. You need to know these things. The out-of-pocket max is the maximum you or your family will pay per year for covered services. Okay. Once this number has been met, your insurance will pay 100% for covered services. And this is kind of like a stop loss, so that honestly you don't become bankrupt paying for medical costs. A lot of out-of-pocket costs seem to average around $5,000, and sometimes it's for individual. And then also family. So family meaning all the people in your house combined. Let's say you have to meet an out-of-pocket max of $5,000 a year, and your out-of-pocket is you've only reached $2,000. But if your family meets that out-of-pocket max, then the insurance will kick in. I hope that makes sense. Usual, customary, and reasonable. This term is usually used to describe out-of-network care. So let's say you go to the Mayo Clinic, and your insurance is going to take kind of almost like an average for cost in that area where you receive that care, and that is what they will pay, the usual and customary rate for that area. Okay, go ahead, Annie. Okay. I assume lots of you hear this term, and it's also good to know this about your insurance. What kind of insurance do you have? Is Is it a PPO, an HMO? Some of the main differences are, generally speaking, this is all general, because all insurances, as we know, are different, and under each insurance, there's different levels, there's different branches. Some have Medicare Advantage, some are corporate, employee. As far as HMO, generally your costs are going to be lower. Your premiums, your out-of-pocket, your co-pays. And with PPO, you're looking at higher cost. And I'll get to why that is a little bit down the road. With an HMO, usually they are going to require you to have a PCP who's going to coordinate your care, okay? And for example, you go to your PCP, you've got, you're having pain or pain in your leg. So you're going to first have to go to your PCP, and then the PCP is going to evaluate it, and they're going to send you out to a specialist. With a PPO, you're not going to have to get a referral from your PCP generally. All right. And HMO, so one of the reasons you have a lower cost with an HMO is because you are limited to network providers, okay? And with a PPO, you have the advantage of seeing anyone in or out of your network. Typically, out-of-network providers do cost a little more and do have higher co-pays and co-insurance. The last major difference is that with HMOs, you don't have to worry about claims. With PPOs, in some cases, you might have to pay for that service or that provider up front. Then you might have to file a claim and then get reimbursed. And that can take, I would say, 30 to 60 days, generally speaking. So those are the main differences. And like I said, it's a good idea to know what you have. Go ahead. Types of Medicare. So this is actually not the full list of all the Medicare parts. I think they actually go to J or K. And it can be complicated outside of these 4 parts. So Part A pays for your hospital and facility cost. A lot of times there are actual facility costs. Let's say you go to outpatient, have outpatient, some minor surgery, or maybe even injections for pain. There's usually a facility cost. So that Part A pays for that. Now Part B is your medical cost. That's your doctor's visits, any kind of procedures that are done, actual surgery, the actual surgery costs and things like that. Part A and B together is the original Medicare. Now patients have the option of choosing Part A, Part B, Part C, what have you. Now getting to Part C, again, that is basically Part A and B put together. But this Part C is normally managed by private insurance companies. For example, when I was working at Samaritan Health Plans, we have a Samaritan Advantage plan, actually several. And they generally have some extra benefits which are not included in the original Medicare. Dental, vision, hearing aids, some of that. And then Part D, that is your prescription drug cost. Okay, let's move on if there are no questions. Okay, so I talked about math problems. So how do you and your insurance share cost? Actually, that should be a question mark. Sorry about that. So we have Jane here. Her plan's deductible is $1,500. And remember, we talked about deductible before. Her co-insurance, she doesn't have a copay. It looks like her co-insurance is 20%. Her out-of-pocket limit is $5,000. So Jane, she hasn't reached that $1,500 deductible yet, which means her plan is not going to pay any of the cost. She has a sore throat. She goes to visit her doctor. That visit costs $125. Jane's plan is going to pay nothing. And Jane will be responsible for that $125. Okay, any questions so far? Okay.
No questions.
All right, I hope that's a good sign. All right, so we're going to use Jane as another example. Okay, now several months down the road, she has met her deductible. Okay, woohoo! That's kind of, it's always kind of a good hump to get over. Now her coinsurance is going to kick in. She's been to this doctor several times and has paid $1,500 in total. Her plan, pays some of the cost for her next visit. She has to see the doctor again. She's having some pain. She goes and visits her doctor. So that office visit is $75. Coinsurance is 20%. So 20% of $75 is $15. That's what she pays. And her insurance is going to pay 80% or $60. All right, go ahead. Example 3. Jane has met her $5,000 out-of-pocket max. Okay, Jane has paid $5,000 in total for the year for medical services. Her insurance will now pay for all her medical costs. Now, of course, none of us actually want to reach that $5,000 out-of-pocket max, but if you have a serious diagnosis and you're having a lot of treatment, that can be a lifesaver. So, all right, let's move on. So when I was working at the health plans, one of the most asked questions would be, I got this letter in there, or this thing in the mail, and it says I owe, I don't know, $3,000. So when I would talk to the member, I would find out they're actually looking at an EOB, not a bill. So insurances tend to send you a lot of EOBs, and anytime you get a service done, there's something that comes in the mail. So I think that can provide some confusion for people. So an EOB is just a document from your insurance stating what charges were billed to your insurance, what your insurance covered or did not cover, and what you owe. It is very important. A bill will say this is a bill. An EOB will say this is not a bill. So make sure as you're getting things in the mail, you're looking carefully. You're looking carefully at patient responsibility. Let's move on, and I'll show you an example. Okay, the picture's next, but let's just go over that. It says, notice this is not a bill at the top, right? Total charged. This is the total amount billed for the service. So your insurance will first get this claim, and they will decide what to pay. So your insurance will say total amount we paid. This is the portion of the total amount billed by your insurance. And then it will talk about co-payment or co-insurance. And that is your responsibility. Occasionally you'll see something that says non-covered. That could be something, like let's say, give an example. Let's say you're going for acupuncture and massage is not part of that benefit, but it was part of that service. That would say non-covered for that portion. Okay, let's move on. Let's look at the example. Explanation of benefits. Perfect. So if you look here at the top, it says this is not a bill. Total charges for this service was $315. The amount the insurance paid was $208.35. And here at the top, it says what you owe your provider. Does that mean you're supposed to write a check or call them right away? No, you're going to wait for the bill. This is just kind of letting you know what your insurance has decided. And sometimes you may have secondary insurance. So first, the claim would go to the primary. Then the primary has to decide what they're going to pay. Then they're going to send that along with something similar, explanation of benefits, to the secondary insurance. So then they're going to decide what they're going to pay. And some people even have 3 insurance, tertiary. So this whole process can take time sometimes. So that's why I'm saying don't pay anything until you could get an actual bill. Okay, next please. Okay, what do? You don't work and you don't have health insurance. What to do? That is a worry. What can we do? So the Oregon Health Plan can be a very good option if you meet their income and residency requirements. It's a very lengthy application, but if you're eligible, they pay, there's no out-of-pocket costs. And a lot of times there is also dental benefits that come along with that. And they are very particular about their network. So generally speaking, for example, Benton County is part of IHN, which stands for Inter-Community Health Network, and Samaritan manages that. That's their Medicaid. Their Medicaid program for Benton, Lincoln, and Lynn County. So Samaritan manages that, and you are generally only allowed to see providers in those counties. It's very hard to see an out-of-network provider. So I mentioned that this process is very lengthy, but there are volunteers and departments which can help you with that application. DHS is one. If you get food stamps and things like that, WIC, they are very familiar with that process, as well as SHIBA, Senior Health Insurance Benefit Assistant. They can also help you with that application process. Another plug for SHIBA, if you're trying to decide which Medicare plan is best for you, they actually have volunteers there. You can set up an appointment with a volunteer and they will sit down and try and find the best plan for you. So that is a wonderful free service. Next, please. Okay, are your out-of-pocket costs and copays too much? You're unable to pay your bills. These are just, they're just too much. And that can happen. So Samaritan, being a nonprofit facility, offers patient financial assistance, or PFA, for those who qualify based on federal poverty guidelines. And there are 3 tiers. You can qualify for 100%, 75%, and 60%. And 100% means Samaritan is going to pay for all of your self-pay costs, all of your self-pay, your co-pays at a Samaritan facility. That doesn't mean you go to some specialized clinic in Lebanon. They're not going to cover that. It's covered at Samaritan facilities. And if you qualify for 100%, there's also another bonus there. You get $300 in prescriptions that you can fill at a Samaritan pharmacy. But the caveat is that it has to be a Samaritan provider who prescribes that medication. Another important thing is it's good for a period of 6 months. Okay, next, please. This, I'm just going to let this slide stay up for a sec. This just gives you a general idea of what those income limits are. For example, you see at 100%, there's a 1, 2, 3, all the way to 8. This means how many people in your household. So if there's one person in your household and they earn $34,500 gross per year, that person most likely will qualify for 75%. Okay, and this includes all incoming money, all income. Could be Social Security, your Social Security benefit, could be if you're working, your pay. If you're on food stamps and things like that, they do add that number in. Okay, next, please. Cost of prescriptions, oral chemotherapy or chemotherapy too much. And by prescriptions, I mean these don't have to be related to your cancer diagnosis. Let's find out what we can do. Okay, help with prescriptions. So I'm also available to help members with other prescription drugs. And again, this is for patients that are part of our cancer program. Sometimes they have drugs like, they're on drugs like Eliquis and Xarelto, which cost a lot of money. So most pharmaceutical companies do have some type of financial assistance plan for people that are finding it's too expensive or don't have the means to pay for their necessary prescriptions. So we certainly don't want you to go off your medication if it's something you need. So if you find yourself having a problem, please do contact me and I'll see what we can do for you. Go ahead. Help with oral chemotherapy medications. So this is kind of out of my wheelhouse, but Samaritan does have a wonderful team of pharmacists and patient medication advocates on staff to help you with oral chemotherapy costs. They can find sources for you, help you with the applications, and obtaining any prior authorization if needed. Okay, next, please. Looks like we're running out of time. Same goes for infusion medication. Sometimes if it's new drugs, your insurance might not pay for it, but we can research what kind of manufacturers financing there is. Okay, go ahead. Problem with your bill. Who do you call? So another thing, when I was working at Samaritan Health Plans, I would get members saying, I got a bill from Corvallis Radiology, and they're saying I owe such and such. Okay, so if it's not Samaritan, you need to actually contact who you're getting that bill from. If it doesn't seem right, don't pay it. If you have any questions about your coverage, I would direct you back to your insurance for that. A lot of people just don't know who to call. Always call first who the bill is from. If you don't agree, call and talk to your insurance. Go ahead. Okay, just in time. How perfect is that?
That was great, Candy. Thank you. We'll look at
any questions?
We don't have any questions right at this moment. I'm going to go ahead and go over just a couple quick slides of information to give folks a chance to write in questions if they have them. Just a moment here. If anyone out there has questions about any cancer-related resources, please feel free to reach out to us at the Cancer Resource Center by phone, swinging by the office, coming in just to say a quick hi. Social media or email are great ways to get a hold of us, as well as subscribing to our newsletter. We do have a couple additional virtual seminars coming up. We have Pancreatic Cancer with Dr. Eric Gershman next week, and our third session of Creating Hope on Wednesday, May 11th. So please register for those if you're interested. And checking for questions again. I'm not seeing any questions
Okay,
at this time.
perfect.
If anyone out there does have any questions that aren't coming to mind at this moment, please feel free to contact the Cancer Resource Center. If anyone out there is interested in speaking with Candy about a bill or insurance question, financial question, or one of the patient medication advocates, please reach out to us. We'd be happy to connect you and schedule a time for you guys to have a one-on-one and get that out to you. Sorry, we have one question. Oh, someone's asking about the recording. This session has been recorded. If you missed it or have someone else out there that wants to watch it, it is being recorded and will be uploaded to the Samaritan YouTube in the coming weeks. So keep an eye out for that.
Perfect. Okay, well, again, I would like to thank you all for taking time out of your busy day, your lunch, and do please fill out the survey. I would love feedback. I'm always up for, I'm like I say, I'm still learning, so I want to be a great resource. So again, thank you.
Thanks so much.
Thank you to Carmen and Andy, or Annie, sorry.
No problem. Thanks
My
for being
apologies.
with us today. We're really lucky to have you on our team.
Right, same goes for you, Annie.
All right, everyone
have a great day.
Great day.
Bye.